like perimenopause, menopause. So if you want to adjust where you're at, but if you have questions, you're like, peace. That's what Megan was just in here. I know. My sister was just in here. I was like, you don't have a uterus. You don't belong. No, anyone can come. But if you have questions and you're not in that phase of life, I mean, a while ago I just had teenage years, and obviously there aren't any teenagers here, so we talked about all kinds of stuff. So anyway, this will be fun. Okay, really, I didn't want this to be boring, but I'll go through some like talking points. I forgot what I put up here. I'll go through some talking points of just things I get asked on the daily, and then we'll leave time for questions because I know you're probably here because you have like some questions about a variety of stuff. So, but I'll just go through some bread and butter kind of things. Okay. There is no such thing as TMI. I'm an OBGYN. I've heard it all. We don't judge. We don't anything. So my best advice is when you're going to see your OBGYN physician or your women's health physician, just put it all out there. Don't be afraid to ask questions or be embarrassed about stuff. Like, we've heard it all. And also, we don't care if you've shaved your legs. Every time I put someone in stirrups, they're like, I'm so sorry I didn't shave my legs. We don't care if you've shaved your legs. In fact, the minute you walk out of my exam room, I don't remember if your legs were shaved or not. So no apologies. I always get that. Okay, so these are just a few things that are just like all random bullet points, but things that I get asked very regularly. Cysts on your ovaries are very normal. It's a very part of your reproductive cycle for your body to form a cyst as the follicle's developing before ovulation, for a cyst to form after you ovulate, because that secretes a hormone called progesterone that would support a pregnancy if a pregnancy were to occur. So cysts can be very normal. Cysts can also be abnormal when they grow too big and are problematic. And I'll talk a little bit more about that later. But if you're told like you have a cyst, don't think there's something necessarily wrong with you. They're very normal. Birth control pills, I was just telling in the adolescent class, I hate that they're kind of called that because they're not, they're used for so many other things. But you might find that your girls are recommended to be put on birth control pills when you're like, gosh, they're 14, or that you're recommended to be put on birth control pills for a variety of reasons. We use them for skin changes. We use them for mood changes. We use them for painful periods. We use them for heavy, irregular periods, for so many different things, for PCOS. And then on that same note, if you're on birth control pills to suppress your ovarian, like your ovulation, it's okay to not have a period every month. We're taught, I think, as kids that you need to have a period every month. You know, like I've had patients come to me like say all the P's are supposed to come out, the period, pus, and what is the other one? P. And I'm like, okay, it's okay to not have a period come out every month if you're on pills to suppress the hormones. So in other words, like your lining won't be building up every month. So people say like, okay, well now I'm having a period every 3 months because I'm on this pill that makes me, and it's okay. I get asked regularly, is that okay? And it is okay. And it is healthy to suppress the periods and not have one every month. Okay. Anatomy wise, the vagina is on the inside and the vulva is what we talk to on the outside. So if I say the word vulva and you're like, what? That's just what I talk to you about the outside genitalia. The vagina is actually like the birth canal, the pathway from the outside all the way up to the uterus is the vagina. So it's just my basic anatomy course in here. And then also the vagina is like a self-cleaning oven. We don't need to do any douching. You don't need to put anything up in there. In fact, gentle, fragrance-free soaps are the best for just general hygiene in that area. Other things can disrupt the normal flora. There's like normal bacteria and things that live in our vaginal area that are healthy, and doing some of the other crazy douching and all this kind of stuff is just not needed, and it can actually do more harm than good. So those are like random points. Preventative stuff, we don't do pap smears until age 21. It used to be that people did them earlier. We don't do them. It's really important. I'm not going to go through all this, but it's super important to go see your physician every year, not just for a pap smear. In fact, that's the minor part of it. And in fact, when we do a pelvic exam, it's not just a pap smear checking for cervical cancer. We are like looking at the vagina and the walls of the vagina, looking for any defects there. We're feeling for the uterus, how it's tilted, positioned, if it's enlarged, the ovaries, if they're enlarged. There's so much that is involved in a pelvic exam, so much more than just the pap smear portion. But it's very important, all your breast health, your colon health, all that kind of stuff. It's just important for just general preventative stuff to go to the doctor regularly every year, even if you've already done, if you're done having kids. And that's, I think, as women, we like go in when we're pregnant or we're trying to get pregnant, and then we kind of stop for a little while because our kids come first, and our spouse might come first, and everything else comes first, our job, whatever, and we put our health kind of on the back burner. But that's important. I'm not going to go through like all the things, but you get the point. Okay, getting pregnant. Okay, I skipped something that I think is super, super important that I didn't put in here before the getting pregnant phase. But when in this phase of life is generally when people are getting married and things like that. So if you're in the category where you're getting married, if you have a child that's getting married, and it doesn't matter if you've been married 5 days, 5 years, or 50 years, physical intimacy is a very important part of a relationship, and it can be just very connecting and very binding to your partner. And it's kind of hard in our faith. We have very strict morals and guidelines, which are very, very good, and that's what makes sex and physical intimacy so special when we are married. But it's hard because we don't talk a lot about those details really until we're married. And then, so sometimes there is some degree of discomfort. I don't want to use the word shame really, but almost like you're embarrassed to talk about it even after you're married, or when your child or your friend or your sister or anyone is getting married. But it is so important to communicate those things. And so I, have friends, kids that are in phases of getting married right now, and I'm like, talk to me. I've got so much to tell you about this part of life. But it's important to have open dialogue and communication, especially with your spouse regarding those things. And it's okay, and can really improve dramatically your connection when you have a strong physical intimacy connection. And by that, I'm meaning like talk through things and be open in communication, and you can be playful and say what you like and don't like. But that is such an important part of a marriage that it's kind of sometimes glossed over because it's an uncomfortable subject to talk about. I am bold, and I feel very strongly in my faith, and I believe very strongly in the law of chastity, but I also believe very strongly in the physical intimacy that can connect a marriage on a level that's beyond. And it's so important for a girl and very often in our faith and out of our faith, for a woman, it becomes an obligation. Sex can become an obligation, or just something they're checking off their to-do list, or something they're trying to create. But it can be just a very enjoyable experience for women. And so if you have questions about that, like I said, I'm bold, and I'm not afraid to like answer any questions about that kind of thing. But it is a very, very important thing, and I just kind of wanted to gloss over that a little bit. Okay, so getting pregnant, I don't know if anyone has any specific questions, but the basic things are, the cycle of the timing. It's best to start trying for pregnancy. Ovulation is like about 5 days before your period, and then I usually tell people to have sex every other day is the best window of time. And then age matters. Fertility does decline significantly after 35. And so I usually tell people, if you've been trying for a year, that's when we start a workup. But if you've been trying for 6 months and you're over 35 is when we should start a workup, because it does impact fertility quite a bit. It's best to be on birth control pills. Not birth control pills. No, it's not best to be on birth control pills when you're trying to get pregnant. It's best to be on prenatal vitamins and stuff even before conception. And it's best if you have other medical problems like high blood pressure, diabetes, to have all those things under pretty good control when you're trying to get pregnant, if that makes any sense. Does anyone have any questions about fertility stuff?
Yeah. When you say a workup after a year, after 6 months, at 35, whatever, what does that entail?
Okay, it entails a lot of stuff. A lot of fertility issues are male factor, in fact, up to 50%. And so it involves a semen analysis on your spouse. And then on you, it would it would require a whole slew of things. Unfortunately, the women always get like the battery of all the testing, but it include things like imaging, like an ultrasound. Sometimes we do what we call a hysterosalpingogram that has dye go through to see if the fallopian tubes are open, and because obviously that's where the sperm and the egg meet and pass into the uterus. So it can confirm that like physically everything's okay. It would also be like laboratory testing to see like your ovarian reserve to make sure your ovaries are functioning, that they are young and healthy, and you're actually ovulating every month. Um, Things like that. Yeah.
So kind of on, I guess, that same infertility question. So my husband and I had to do IVF, and we've been blessed with two children with that. But they told us that we were the 10% undiagnosed, that everything works, but they didn't know. I mean, I kind of feel like that was a cop out, but is that? I just would like some more information. Is that true? Is there really just
There is, and
okay?
unfortunately, and I forgot to tell y'all. I guess you know on the paper I'm an OBGYN, so like I didn't introduce myself at the beginning, but anyway, um, that is, and that's actually some of the hardest people to treat is the unexplained infertility. That's
Okay.
probably what they told you. You're
Yes.
the unexplained infertility. So the easy ones are the ones that they're just not ovulating regularly. You put them on a little, stimulant for their ovaries, a little Clomid, and then boom, it's the low hanging fruit, and you're just like, oh, you're pregnant, great. And then there's, male factor where okay, the sperm aren't swimming right. We've got to put the sperm directly into the egg, and we could do that, in a petri dish. Great. There's all these different things, but there is this category of unexplained infertility. And for some reason, all the testing is fine. And my sister fell into that same category, which is a very difficult category to fall into because, if the semen analysis is fine, your tubes are open, you're ovulating, your ovaries look good, you're going through all these things that all look fine and still it's not happening. It's really frustrating as a patient, and it's very frustrating as a provider because it's just harder to fix. We try to do all the things we would normally do, like IVF, and just hope that it's going to work out fine. And there's not a thing like, oh, okay, the tubes aren't open, so we need to just bypass the tubes and just implant it straight into the uterus. Okay, this isn't, like there's not a certain thing we can target and fix. And so we just have to try IVF, which is the biggest thing, and hope. Thank goodness you have two babies, but that is the hardest one.
I was just curious if
Yeah.
if that was kind of
It's not as common as something. Usually we can pinpoint a problem, but there's a big handful that fall into your category of unexplained infertility, and that's one of the trickiest ones. Yeah. Anything else about getting pregnant? Okay. So on to pregnancy stuff. Okay, everyone, there's like a huge variety. We could spend like all weekend talking about stuff in pregnancy. I'll tell you, every pregnancy is unique from person to person, from yourself, like Taylor, we're having baby number 4. This one's probably very different than the other ones. I mean, it's just like your body changes, and every pregnancy is just very different, just within yourself and from person to person. I tell all my patients when they're pushing, it's not like the movies. They push one time and they're like, am I doing it wrong? And it's like usually a process. It's not one push, a scream, and then a baby. So that's different. Birth plan. Everyone asks me about a birth plan. They come in with usually pages of a birth plan. I'll tell you that childbirth has evolved in the hospital setting, is how I deliver babies in the hospital setting, not home births, but it's evolved significantly in the hospital setting to be more mother baby friendly. We, bring the baby in a vaginal birth, for example. Everyone wants a vaginal birth. We all want a vaginal birth. C-sections are reserved for cases that it's just not safe for the baby, not safe for mom, whatever is the case. But we bring the baby straight up skin to skin. We do delayed cord clamping. Some of the hit lists that people have on their birth plan are things we do normally. So that's what I tell people. Like we do, the golden hour of just immediate skin to skin without taking the baby away. We delay the bath. We have dad cut the cord. All these things that people usually have on their wish list are what most physicians do normally. But if you have something that you really feel strongly about, you just tell it. Like, Dr. Nolan, I want this. And usually we're able to accommodate all that kind of stuff. Does anyone have any pregnancy questions? Taylor said she's willing to demonstrate having a baby. We're ready. We're ready for this baby just after tomorrow because she's our pianist for our primary program. Yeah, you have a question?
Yeah, what are the best ways to try and avoid an episiotomy?
Okay, so back I've been delivering babies for 20 years, which sounds like a long time when I say it like that. It is a long time. And back when I first started, episiotomies we routinely did in first time moms because the research back then was that like, oh, an episiotomy is a straight cut. It comes together better than a tear that can be jagged. And so anyway, we routinely did them in first time moms. And now we swayed way in the opposite direction. There's a handful of very old school physicians. So I don't want to say we don't do episiotomies because I've been told Dr. So and so does them. And I'm like, what? But generally, we do not do episiotomies anymore. So I would just double check with your physician because I don't want to talk about every physician out there, but we generally don't do them anymore because there's a lot of like natural stretching that happens in those final stages of pushing. We can do some perineal massage that kind of helps with the stretching. And then generally when people do tear, it's not any worse than what an episiotomy would be. And it's shocking. I've had 16-year-old teeny tiny girls push out a big baby with almost no tearing. And so back when we used to think, oh yeah, everyone's going to tear with their first, it's just not the case anymore. So most physicians don't routinely do episiotomies anymore, but I would double check.
Well, and as my first one, yeah, he had just kind of did it, and so for my second one, we had talked, and she was like that he had cut really long for it, and she's like, we were gonna really try not to do that. And when it came time to it, she was like two-handed in there, like trying, and still wound up having to like cut. So is there
Cut.
things like leading up to really kind of try?
There's not
cope with
anything
that?
like just for the stretching, not leading up to, because really in the pushing phase is when everything stretches out more. And when you're still in the pregnancy phase, there's not anything. I mean, you can just ask that they like use a lot of lubrication with mineral oil and stuff like that. I imagine, was there difficulty like with your delivery, like delivering the shoulder or anything? No? Okay. You might just have like a tight band of tissue and it could have like the first episiotomy that might have scarred just right back again tight and not kind of given the stretch. And so maybe
Yeah, because she had spent like a good amount of time trying
stretching.
like
So
working really hard.
everybody's body is totally different. I mean, it's just like my sister had 4 babies and she tore like pretty significantly with each one. It's just like, and then you have other people, they tear with their first one and then they never tear again. And so it's just so different how it heals down there. But it could just be that your anatomy is such that everything's tighter, which can be a good thing too. So you might just tear every time. All right. Anything else about pregnancy stuff? Okay, we'll get to some of the other. Let me see what I have
Like
here.
there was another one.
Yeah.
I was just gonna ask for nausea because I can't take anti-nausea meds because of the condition, and I'm nauseous the whole 9 months. What are any
Okay,
recommendations?
so you've tried all nausea medications. You just
I
have
a heart
side effects.
condition, so I can't
You
take
okay?
any, yeah, and I'm
So
nauseous the whole 9 months.
vitamin B6.
Okay.
Can you take that? You've
Yeah,
probably been told that already.
yeah.
It's not going to help all the way, but it can help a little bit. Unisom.
I would do the That
Okay.
was kind of my.
I was going to say that's going to be your go-to is
Okay.
Unisom and vitamin B6, separate from all the other
Yeah. I didn't know if there's
nausea
any
meds.
other-
There's not any yet,
Okay.
but maybe one day.
Okay.
Yes.
I learned about peppermint.
I had a EMS tell me about peppermint.
Peppermint, yeah.
Yeah, so there's peppermint teas that are anti-nausea.
Any of the herbal stuff you can try that. The pressure point stuff you can try. Yeah, peppermint teas, ginger stuff for sure. But as far as like medication wise, that kind of is stinky. And it's crazy because some people have nausea all throughout their pregnancy. Some people have it at the beginning. Some people don't have any nausea at all. And it's just like all over. You're probably in the category where you have it the whole time and you can't take anything for it, unfortunately. All right, cool. I love that idea. Anything else as far as pregnancy stuff? Okay, so I just put on here just some kind of like regular like health concerns people always have, like, oh, I'm having this problem with my periods or variances. Does anyone have anything specifically they have questions about, or you just want me to kind of talk through stuff? Yeah.
I just have a question, I guess, kind of about the variances with like PCOS. I don't know if it's like the age that I'm in, but it seems like everybody has it. Have you seen that, like a ramp up?
There is definitely a ramp up in PCOS. I don't know if it has to do with environmental factors or whatever, like in our food we're ingesting or whatever. But so PCOS is kind of a funny one. Did I put a thing on here of PCOS? Let me see if I did. Oh, I just put a little bit of thing. But it's like the ovaries have these small little cysts on them, and that's a small part of it. Really, as you know, if you have it, it's a bigger issue. It's called polycystic ovarian syndrome, and because it's named because on ultrasound people have these little cysts on their ovaries, but really that's like the smallest problem of it all. Really, it's a hormonal imbalance that causes increased levels of male hormone, which can make your periods irregular, sometimes impact like acne and hair growth, and just cause problems with fertility, irregular cycles. It can lead to some pre-diabetes concerns of like blood sugar issues. So it has like um, a whole gamut of like metabolic issues associated with it. And you're right. There has just been, I don't know the full reason behind it, but there has been an increase. I don't know if it's increase in diagnosing it because we have better like laboratory tests and stuff than that we used to have. But it is a very prominent and prevalent disease among all teenage girls, middle-aged girls, but it's very, very common. Yeah. Any other questions? Yeah.
Yeah, about all these issues. I know like OBGYNs are mostly like pharmacology kind of like let's do pharmaceuticals because that's what they know. How much is it that they choose more natural supplements or like more natural things? Like you're talking about vitamin B6.
Mm-hmm.
How much is that versus like pharmaceuticals? Kind of like what's the balance there?
That's a good question. I would say, yeah, in medical school, everyone is trained. They have these like big pharmacology classes. They're learning all these medications. Then you get out in residency, and you have these pharmaceutical companies. Look what this drug can do. Look what this. So definitely, it is very heavy in the pharmaceutical medication realm. Um, Particularly in the older years, like menopause, people are definitely a lot more interested in the natural things. I would say most of us have like done rotations and stuff in more holistic medication to where we're and definitely I would find a physician that is open-minded to that kind of thing. um, and there's a whole, I would say, range of people. Like some people are like, oh, that's hogwash, and they're not gonna. And then you have some people that are very open. There's a lot more of these holistic kind of practices where they're like are a lot more open to a blend of Eastern and Western medicine together, which actually is honestly the best. um, I will say that, like, for example, in perimenopausal and menopausal health, there's things, to help with menopausal symptoms like black cohosh and all these kind of things. There are some research studies when they do some of these things, and just like they're sometimes not quite as effective as the pharmacology options, but that doesn't mean that it's not worth it because sometimes the side effects are much less. So in other words, I guess there's not a right or wrong answer, but for everything, there are some like holistic or more natural kind of options. Sometimes they may not, according to research studies, be as effective, but sometimes you're willing to take that when the risks might be less. If that makes sense. But that's a good question. It's really like nice when you find a provider that is like open to discussing those options. And some of them, I would say, in fact, there's probably a majority of them that just aren't, either they don't want to spend the time talking about it with you, or they're not as educated or open-minded about it. So it's an important realm of medicine. It's becoming more and more common and prevalent and popular to like discuss some of these more natural remedies. So it's definitely an important thing. But for every like issue, there's usually something people try, whether or not it's like super effective or not, is on the table. All right. Melanie.
I didn't know if I was going to make a comment about this or not, but just going on your question. So I'm doing IVF right now, and I'm in that category where they're like,
Unexplained.
we don't know what's going on, and I did my 4th egg retrieval just a couple of weeks ago, and when we started that one, the doctor said she had me on a supplement that they have done research that will help with egg production. And then she said, there's these 2 other supplements that there's not a lot of research, but let's just try them. And so she was like, we don't know if this will help, but
it's worth a shot.
Here's the supplement to try. And so, I think, at least in my experience, there's more of that research going on with
fertility.
Yeah, and honestly, I mean, like the big pharma companies are the ones with the medicine to provide. I mean, the finances to provide all these research studies, and so that's where we kind of hit these roadblocks with some of the more natural supplementations. There's not like a big, you know, big wig in the background funding research, so there's just not enough research. It doesn't mean that it's not helpful and everything. So a lot of times it's like that. Well, it's worth a shot to try it. I've done that many a times with patients on various things saying, well, we know it's not going to do any harm, so you might as well try it, whether or not it'll help or not. But yeah, definitely. And so it is nice when you have someone like a fertility specialist that is used to doing all kinds of, invasive procedures and serious medications, and they're open to trying all things. And so it's really important to find someone that jives with you and that kind of thing. Yeah.
Just like on a fundamental level with like hormones, I know birth control is hormones.
Yes.
Is there anything else that you take that like changes your hormones? Like with the PCOS, like increased male hormone, can you take something that like decreases it, or with
Yes. So there are other things that impact hormones for that we use in endometriosis, in people that have fibroids, which are like growths in the uterus. For PCOS, there are things that like suppress male hormone. Spironolactone is the one that comes to mind. That's that. There are other things that kind of suppress and put you in like a pseudomenopausal stage that we use for some of these things like endometriosis and even with fibroids. So there's things that are similar to birth control pills that aren't really birth control pills that all act on the hormones.
And they don't affect your fertility?
They don't affect your fertility long term, the best we know. So, but it's just individual as far as but there are a bunch of different hormonal, there's things that stimulate the ovaries, there's things that shut them down, all kinds of different hormonal medications for a variety of things. But. Yes.
Different topic, if that's all right.
Yeah.
So I'm pretty sure that I'm done having babies at least for a while. And my question is, what are some like top 1 or 2, 3 things that I can do for my health that I should be aware of? I mean, obviously you mentioned getting the pap smear checkups every 3 years and then all those other steps, but are there any other things that I should be aware of on a daily or regular basis?
That's a great question. So you still have your uterus, I'm assuming?
Yeah, I'm fully intact.
Okay. So I would just watch your periods. Periods become irregular as we get closer to the menopausal years, and that irregular time period can start in that like 10-year window before that. So anyone that's over 35 and has like really heavy periods, I say you should probably be evaluated for that because there is a chance you can have like kind of an overgrowth in the uterus that leads to endometrial cancer. So that's one thing I would watch. Once we go through menopause, okay, there's no more bleeding. We watch for any bleeding. But in those years leading up to it, after you're done childbearing, it's common to have heavy periods. Your periods might have gotten more heavy after each child. But if you start having wacky periods at age 35 or older that are really heavy, then you might want to be evaluated for that. That's one thing to watch out for. The other thing is bone health. Okay, so we've built up our bone health in our early 20s, and it's honestly we're just on the decline right now. And so vitamin D, calcium supplementations for the bones because they're only going to get weaker. So walking and strength training does help that, but that's one of the things people kind of ignore because it's like, okay, but it has a big impact, like 30 years from now, it'll be hitting you hard if you don't. So that's one thing that I would like kind of pay attention to now. It's just good. I usually just, even though I'm done having kids, I just try to take a prenatal vitamin because it's just a well-rounded vitamin, but you need additional calcium, honestly, than what's in that. So that's another thing I would do.
And do you absorb it well from vitamins or
calcium? Yeah, the vitamin D, it helps with the absorption. So that's why, depending on some calciums have vitamin D with it. Sometimes you need to take extra vitamin D with it, but just like the vitamin D helps in the absorption. So definitely. I'm trying to think what else, but those are some of the main things I would watch out for.